Hello everyone, my name is Christina Lynch, and for my public health project, I've decided that I'm going to talk about the people in Rubbertown, which is a community in Louisville, Kentucky. I'm very interested in the toxic air this community has due to the massive amounts of chemical manufacturing that happens here, so I wanted to learn more about it. This area is a large industrial area where lots of pollution is released into the air, which raises major concerns for the residents that live in this community. Many people believe that the reason for health problems in this community, such as different types of cancer, are because of these industrial companies and their toxic waste. For locations within 1 mile of Rubbertown industrial area, 30,461 persons resided in 13,303 households. Of these, 36.9% were white and 61% black. The demographic statistics indicated 2,920 children aged 6 years or younger and 4,782 adults aged 65 years or older. I believe that place has a lot to do with population health for many reasons. The small community of Rubbertown is the poorest community in the entire city of Louisville, which is a huge risk factor for poor health. Socioeconomic status can be a big determinant of health because, for one, in low socioeconomic areas, there tends to be a lot more crime, which can lead to more stressful situations, and stress is certainly not good for your health. Also, places like Rubbertown, where there are many factories which pollute the air, will pose as a health risk factor. Resources for the communities are huge as well. For example, access to healthy foods. The way we live our lives is going to determine our health just as much as the place we live will determine our health. Often people who live in big cities are exposed to a lot more things such as pollution, germs, marketing for unhealthy foods on every corner, which will in turn cause health problems. There are a few different types of cancers that can and are known to be influenced by environmental factors, such as bladder cancer, tumors of the central nervous system, and leukemia. However, these were not the cancers that were prevalent in Rubbertown. The two cancers that were found to be higher in Rubbertown than any other zip codes in the city were lung cancer and colorectal cancer. The community had a 35% higher chance of developing lung cancer and a 31% higher chance of developing colorectal cancer than the rest of the city. Cancer is a disease in which cells in your body grow uncontrollably. Colorectal cancer is developed when the colon develops abnormal growths called polyps, which, if they're not removed, they turn into cancer. Colon cancer typically affects elderly people, so it's important that they're screened regularly. Diet, exercise, limiting alcohol, and tobacco use are all ways to reduce your risk for colon cancer. Due to the lack of resources in the community of Rubbertown for healthy diet, air pollution, and the low socioeconomic status, we can see why they would be more at risk for colorectal cancer. Lung cancer is the second most common cancer in the United States and the leading cause of cancer death. Lung cancer was 14% of all cancer diagnoses, and 27% of those were fatal. Lung cancer is caused by smoking, secondhand smoke, or exposure to substances like radon and asbestos. It's easy to see why Rubbertown may be more susceptible to lung cancer, as it's a huge industrial area, so not only are the workers in the factories exposed to harmful substances, but the substances are also released into the air, which is affecting the civilians. One other major concern for the community of Rubbertown was liver cancer. and liver disease. Because of the exposure to vinyl chloride, many factory workers were exposed to the chemical being released into the air as well. A study done on workers from the Goodrich factory shows that out of 25 workers, 21 of them had developed fatty liver disease. Vinyl chloride is a major concern in Louisville, particularly on the west side where Rubbertown is located. Vinyl chloride is covered under Louisville's Strategic Toxic Air Reduction Program, and companies are required to get permits to emit the chemical. It's been detected in air monitors in West Louisville for about 14 years, ever since Russ Barnett at the University of Louisville started testing the air for dangerous chemicals. Since the air reduction programs and new infrastructure, there has been an 80% decrease in the number of toxic chemicals in the air of the community of Rubbertown. But the smell still lingers around. So we can only hope with these new programs that they are making the air safer, but the people of this community are concerned that the air is still not safe and wonder what damage it's going to do to their bodies. I think that if we continue to follow policies and procedures for emitting harmful substances into the air, then the air quality should improve. I certainly think that the Environmental Protection Agency should get more involved in these areas with toxic air pollution, like the community of Rubbertown. Due to the low socioeconomic status of the people in this community, some are unable to access the proper health care. So maybe a program offering yearly physicals for the people of Rubbertown would be helpful as well. These people deserve a better quality of life, and the public health officials should do their part to see that they get it.